My name is Hak Choi, and I'm one of the founders from four communities: Korean, Spanish-speaking community, Portuguese-speaking community, and Vietnamese-speaking community. Four communities representatives were initiating making community health center. In the movement actually started early 80, like 83, 84. I was a kind of activist to advocate on behalf of young immigrant ethnic communities, immigrant communities, for accessibility, equity of public service. We had I don't know how it was called, but town hall meeting, community meeting after meeting. So at the beginning, I think around 10 ethnic community, young immigrant community were gathered. But in the process of getting recognition, many had to leave. And at the end, 4 communities remained, which were the founding community. I was sent as a representative of Korean community in the task force to create a kind of access point or primary health care service resource, which is very culturally appropriate for newly arrived immigrants at that time. But as I told you at the beginning, there were about 10 communities were there, but gradually left, and it took long. Meeting after meeting, I can't remember how many meetings we had. Many meetings with public health staff and the activists from different ethno-cultural community organizations. And they must be tired. It took too long. We advocate to the government, to people, associated with this, and so they left. And at the last, 4 communities remained. Access Alliance. We were, thinking of what would be the proper name for this organization. We always advocate for access, equity service, so we should use access in the name, official name. So at that time, we have clinical part and health education part in the organization. There is as today, primary health part and clinical service, and the prevention side has education and administration in the organization. We founders or remain. The good thing, these 4 founders background or medical area. Myself was nurse, and Dr. Nguyen is pediatrician. Mauricio Perez is also doctor. Ilda was history. I can't remember, but she was also closely related with medical service area. So we we're working hard to submit the first budget of this, since it was approved. So we could get the first budget without cutting. And since then, government used us as an example of service access and equity of service to the all immigrant communities.